Over the past 3 weeks, coming into this role, you would appreciate that I receive many, many briefings. There is a lot of information that's presented to you. One of the briefings and one of the sets of information I just could not get past was what was occurring in our residential aged care sector. As a result of the work that the government has been doing, the unannounced visits, the compliance audits, it has revealed a very disturbing trend in what is happening in terms of non-compliance and abuses and failures of care that have been occurring across the sector. Now, that said, we know that across our residential aged care sector and in-home care, we have some of the finest facilities anywhere in the world, indeed better than anywhere in the world. Indeed, this is an area of export growth, actually, training of services, building of facilities. This is something that Australians are very good at. And I want to pay tribute to all of those who work in these facilities. I and Ken and Greg have visited many of them, as you'd have expected, as local members, as ministers and treasurers, as Prime Minister. And what that says to us is we've got great people doing a great job, and they're a great team. But every great team wants to do better. Every great team wants to be able to ensure that where there are problems in their sector, in their industry, then they want them to be addressed. A 170% increase in services with serious risk identified in the past year. A 292% increase in services with significant non-compliance. One service being shut down by the Department of Health every day. 154 notices of non-compliance. That's an increase of 185%. Sanctions up 136%. That's impacted some 2,000 residents out of what is a standing group of just over 200,000. When you're confronted with that, you ask a simple question: how widespread is this? How far and wide does it go? Does it touch on the whole sector? Now, until we can have clear answers to those questions, I think Australians will be unsure. And that's why, as Prime Minister, last week, we discussed this together as a cabinet, and we decided it was necessary to move forward with a Royal Commission into the aged care sector, which includes the care provided to young Australians living with disabilities in the residential aged care sector. We're not going to stop and wait for this Royal Commission to finish before we keep getting on with the important work that we're already doing. We will walk and chew gum at the same time when it comes to this issue, and that is important because there is great work that is being done, but more needed to be done, in my view, and that's why I've brought this forward. Secondly, we've got to take the politics out of this issue. I spoke to the Leader of the Opposition last night. We've had good bipartisan support when Labor was in government and when the Coalition has been in government. We want that to continue. And we want the issues to be identified as the facts. We want there to be an impartiality to this. We want political agendas taken out of it. So let's get an independent, credible, honest look at what's happening in the sector, and let that be the basis for our continued working in partnership all around this place, focusing on the care and needs of Australians and the choices Australians are having to make about aged care. And that will be an important opportunity, I think, with this Royal Commission to ensure that that's the case. And when you pull all that together, I think, combined with the work that we're already doing, we will be in a better place to be able to give Australians the assurance that they're seeking. But to just run through what we expected to cover, it will be as follows: the quality of care provided to older Australians and the extent of substandard care. The challenge of providing care to Australians with disabilities living in residential aged care, particularly younger people with disabilities. The challenge of supporting the increasing number of Australians suffering dementia and addressing their care needs as they age. The future challenges and opportunities for delivering aged care services in the context of changing demographics, including remote, rural and regional Australia, and any other matters the Commission wishes to pursue that they believe is necessary. So the issue isn't just in metro centres or just in rural centres. It's not just in for-profit or non-profit. It's right across, as best as we can determine from the compliance work that has been done today. So we do.
Cut $2 billion from aged care. And
no, that's what the Labor Party said.
No, you did.
No, the Labor Party said that.
No, you cut $1.2
No,
million.
I don't accept that. So if people want to put questions, they're not allowed to put lies. Okay?
had $1.2
No,
billion
we're increasing aged care funding by $1 billion every year, and we put in place
Prime Minister.
compliance measures to ensure that public
The
funds
aged care
don't
funding
get
instrument had
misused.
$1.2 billion taken
This is
from-
why we're going to have a Royal Commission.
Are you ignoring the facts?
No, I'm not ignoring the facts. That's why I'm calling
I've
a Royal
reported on it
Commission.
in two budgets.
No, if you just let me finish the question, finish the answer. This is why I'm having a Royal Commission, because I'm not going to put up with lies being told about what's happening in the aged care sector. Policy must be based on facts, not facts that are dreamt up, not facts that are misinterpreted, not facts that have agendas sitting behind them. A Royal Commission doesn't have any of those maladies. A Royal Commission will actually look at the actual facts, not at the agendas of advocates, not at the agendas of media, not at the agenda of politicians. A Royal Commission will be focused 100% on the needs of residential aged care residents.
Mr Wyatt, can you perhaps explain your comment to Four Corners?
In my comment to Four Corners, when I was asked about a Royal Commission, I said I would rather spend the money on frontline services for aged care than a Royal Commission at that point. But there are a set of circumstances that I've seen in aged care since that time, including in my own electorate, that takes me to the point that it is a crisis issue that individual families face when a daughter wants to get her father into aged care, has him placed, and then the aged care provider in that circumstance saying we can't take him. She went through incredible emotional experiences in trying to accept the fact that her father had been rejected. On that basis, I gave reconsideration to the need for a Royal Commission. It's something that I've been talking to the Prime Minister about in terms of senior Australians when I first took on the portfolio, and we had a lengthy discussion in Perth about senior Australians and what we needed to do. Scott Morrison, as Treasurer.
But these were comments. You made these comments on August 16, Mr Wyatt. I mean, is it one case since August 16 that's changed your mind where you think it's a waste of time and money to have
let me correct you. Read the transcript. It says, I didn't support a Royal Commission. I would rather spend the money on... No, hold on. I would rather spend the money on frontline services that were important because amongst senior Australians in aged care... Now, hold on, let me finish, Andrew, let me finish. We have senior Australians in aged care who need mental health support. We have senior Australians who need palliative care support. We need senior Australians who need support at home in terms of emotional and social wellbeing issues. That's where I wanted to put the money. That's where I wanted to look at the changes that we put into place to help those who are vulnerable. Now, a Royal Commission is necessary. It will build on what we're doing.
When will the Royal Commission begin? And are you prepared for what it will find? Whenever we have one of these Royal Commissions, we turn over rocks and we have all sorts of cockroaches. And it might end up looking very damaging for the coalition that this Royal Commission wasn't commenced much sooner.
Well, in the first 3 weeks of being Prime Minister, I've taken the action to initiate a Royal Commission in this sector. I don't know if I could have acted more promptly than that as a new Prime Minister looking into these areas. I think you're right. I think we should brace ourselves for some pretty bruising information about the way our loved ones, some of them have experienced some real mistreatment. And I think that's going to be tough for us all to deal with. But you can't walk past it. You can't not look at it. And that's what the government is ensuring that we don't do. That we actually, well, the date, we will seek to finalise the terms of reference, as I said, over the next few weeks. And then we would then seek to ensure that we have the commissioners appointed, and we'll be consulting on the appointment of commissioners and letters of patent. And, well, this Royal Commission would take at least until the second half of next year. I have no doubt about that.